This is 7 National News, and in our top story, following the conclusion of the Dubai International Peace Convention, which began 2 years ago, is the launch of the Mohammed bin Rashid AlMaktoum Award for World Peace. His Excellency Dr. Hamad bin Al-Sheikh Ahmed Al-Shabani, the chairman of the Board of Trustees for the award, elaborated at a press gathering earlier today its objectives. According to the committee, the Mohammed bin Rashid AlMaktoum Award for World Peace endeavours to recognise and acknowledge those dedicated to efforts that promote and contribute to world peace. The award will be presented every 2 years, beginning from 2014, in conjunction with the Dubai International Peace Convention. Based on the promotion of respectful dialogue, the award stands by the values of equality, integrity, responsibility, transparency and tolerance.
To start with, the United Arab Emirates has shown that it has really a solid infrastructure for such a peace award, because it has so many cultures, nationalities coexisting together peacefully. And what the award would do and the way it would take that is perhaps different. Is that it's not going to be politically driven, it's not going to be forced. It would really represent a true world peace, and this is what we are aiming to in the next 2 years.
Local and international health experts say integrative medicine is the way forward for the healthcare sector at the second edition of the Integrative Medicine Conference. Dr. Aisha Abdullah, the managing director of Dubai Healthcare City, said the gathering is timely and necessary, especially with the rising costs and poor outcome of healthcare in general across the globe. Currently, Dubai Healthcare City is home to 12 complementary and alternative medicines, or CAM medical centres, over 50 CAM licensed professionals, and offers treatment in 14 areas, including homeopathy, traditional Chinese medicine, guided imagery and yoga.
Complementary and telemedicine is a very wide thing. We only regulate 14 services, which is acupuncture, traditional Chinese medicine, Unani, Ayurveda, homeopathy, and so on. Only 14 services that is evidence-based only. We don't regulate other part of complementary and alternative medicine. Only the one that's evidence-based. The difference about complementary and alternative medicine inside the healthcare city, we did our due diligence. So the practitioner, we checked all his credentials. We did primary source verification to make sure he knows what he's talking about. We do two times a year survey on the facility to make sure they're up to the international standards. So we try our best to make sure that practitioner is safe to practice complementary and alternative medicine.
Dr. Andrew Weil, a world-renowned and pioneer of integrative medicine, attended and chaired the Advances in Evidence-Based Integrated Medicine Conference. The leading figure of integrative medicine highlighted case studies that benefited from it. From treating chronic pain and diseases to depression and cancer, the practice offers a host of benefits and a range of treatments. While it is being promoted, he said integrative medicine neither rejects conventional medicine nor accepts alternative therapies uncritically.
Integrative medicine is a new form of medicine that really focuses on the body's natural capacity for healing, looks at all aspects of lifestyle, treats patients as whole persons, not just physical bodies, but also mental, emotional beings and spiritual entities and community members. It places a great deal of emphasis on the practitioner-patient relationship, and it makes use of a wide range of therapies, not just conventional drugs, because it really focuses on lifestyle. It can practice real prevention and health promotion. And secondly, it can identify and bring into the mainstream treatments that are less expensive because they're not dependent on expensive technology.
The capital witnessed 71 fatal injury deaths last year, 53 of which were from falls and falling objects. The Health Authority Abu Dhabi launched the Height Aware programme today that looks to lower occupational fatality rates. The programme supports employers in complying with the requirements of the Abu Dhabi Environment, Health and Safety Management System and targets occupational health and safety professionals, supervisors and workers. The information within the programme highlights the procedures designed to give guidance for safe work practices when working at a height. The programme aims to reduce fatalities due to falls and falling objects by 10% annually through a healthier working environment. That's according to the Director of Public Health and Policy, Dr. Omniat Al-Hajeri. Experts also warned about pigeonholing workplaces that are bound by height, as many associated with the construction industry. However, this does affect sectors such as agriculture, industrial sectors, as well as commercial.
Basically, the program itself has been developed based on statistics that the Health Authority has been collecting over a number of years. And what we have found is that falls and falling objects are the largest cause of fatal injuries on work sites in Abu Dhabi. So we've decided to actually address this through this program and actually develop materials which will create awareness of this issue, but also to protect workers by actually helping them to understand the risks that are involved in this.
The Ministry of Education has introduced a unified academic calendar and a list of new rules set to be implemented for all schools and universities across the country, according to a local daily. The ministry insists that no school will be exempt from the unified calendar or receive any leeway from the Knowledge and Human Development Authority. Each private school will be judged on a case-by-case basis, depending on the number of school hours and school days. According to a local report, the Minister of Education, Humaid Obaid Al-Khatami, stated that the calendar will be implemented to protect the strong bonds of families and make life easier for people living in the UAE, including Emiratis as well as expatriates. He further added that several educational institutions are linked to foreign educational systems. However, there shouldn't be a connection with the holidays and breaks students receive here in the UAE. With temperatures expected to reach 48 degrees Celsius in the UAE during the month of May, the Ministry of Labour has announced that the midday break in the country could start early this year. This prediction has prompted officials at the ministry to consider moving up the mandatory 12:30 to 3 p.m. ban on outdoor work to the 1st of June this year, rather than mid-June. According to a local report, a senior Labour Ministry official stated that they are still awaiting a report from medical authorities about the risks of working in the afternoon at the current temperatures, and confirmed that once the midday break period begins, Labour Ministry inspectors will begin to conduct worksite visits to raise awareness about working safely in the heat, as well as daily inspections to ensure that the law is being adhered to. And up next, we'll have the day's business news, so stay with us.